Hey guys, how's it going? I want to quickly discuss about the heart's pump function. Heart is an amazing organ. It's got, elaborate electrical network, and when that gets messed up, then the heart might start beating too slow. Then the patient would need pacemaker placement. It might start beating too fast, and then they would need radio ablation treatment. So that's all about the electrical network. And then it's got elaborate plumbing network. And when that gets messed up, then patient may need stent placement. They may need bypass surgery. So that's all plumbing related. And then the mechanical property of the heart is that, it can pump blood out of the heart. Because when people discuss about the heart, they'll normally say like, oh, my heart pumps 60%. So they'll say some numbers like that. It's usually a percentage. And that's what I want to discuss about. When you really think about it, several organs in the body, they all have pump function. Like the gallbladder, it collects bile from the liver and then it pumps it out to the intestine because it's got muscle. And so the gallbladder ends up acting as a pump. And then the urinary bladder, it collects urine from the kidneys and then it pumps it out. So it acts as a pump. And then the intestines, from your food pipe, it keeps pumping food from one part of the intestine to the next. So the intestines act as a pump. And then the uterus, in women who are pregnant, when they're ready to deliver a baby, then the uterus pumps it out. So all these organs, they are capable of acting as a pump. So the heart pump is the most important. It pumps blood out, and that's what keeps the whole life going within the whole body, right? So the left ventricle, when it is dilated, it's ready to take blood. And that is the blood that comes from the lungs. And that's the oxygenated good blood. So do you know how much of blood it can take when it's in dilated condition? It takes about 120 mils. So in relaxed position. And then once it gets at 120 mils, then it contracts. When it contracts, it's able to get about 70 mils out. So 70 divided by 120, that's about 60%. So that's the normal pump function. So the heart, left ventricle, should be able to at least pump 50% of its blood out, like maybe 60 mils. So out of the 120 that it collects, if it's able to pump 60 out, that's a couple of ounces with each heartbeat. So that's 50%. So anything about 50% is good, normal pump ejection fraction value. But if it only pumps 40 mils, if it takes 120 mil in, and if it only pumps 40 mil out, then that means that it's only pumping 30% out. And that's not adequate because those patients are going to be huffing and puffing because water is going to be just building up in the lungs and it's going to build up in their legs. That's heart failure. So I hope this video explains to you what left ventricular ejection fraction means. And the take-home point is that it's got to be at least 50% or above. Talk to you later in my next post. Goodbye.